Ultimately, universal healthcare has many benefits that outweigh the potential risks. Would you rather wait longer for non-emergent and preventable medicine so all can receive healthcare and end preventable and avoidable death? Or would you rather be able to choose your own health insurance, possibly be seen quicker, knowing this is causing unnecessary death in our society? In my perspective, the morality of the situation outweighs the gain from being seen quickly. Even in areas such as South Korea that has universal healthcare implemented, they were able to provide, quote, early detection through the National Cancer Screening Program, which was expanded to cover the entire population in 2004, enhancing accessibility to treatment and medication through the National Health Insurance, end quote. Whilst a single-payer universal health insurance isn't the single change to be made to repair a broken system, it would end the unnecessary suffering of the individuals with inaccessibility and or barriers to healthcare. Even if the enactment of federal universal healthcare would be financially significant, the ultimate financial cost would outweigh the morality of the situation. In the end, how much money are the helpless individuals' lives worth that don't have access to healthcare in our country? Additionally, whilst our medical staff may be overwhelmed in the current state of our healthcare system, they are trained to work under pressure and in time-sensitive matters such as emergencies. Having access to the emergency room alone is life-saving, even if it would take days to be admitted to the floor for non-emergent cases. The emergent cases would be purposely prioritized. Severe, life-threatening cases would never be intentionally made to wait, as this imposes significant risk to the patient. Universal healthcare is directly about decreasing the patient safety risks, specifically those that are implied when a patient is uninsured. There would ultimately have to be a significant presence of triage to take place, which is already occurring day to day in our healthcare system. To combat the longer waiting times, patients might have to be more aware of their own health status in order to detect changes and know when to seek emergent care. Therefore, education would be a large component of the transition to universal healthcare. The percentage of uninsured has decreased ultimately. As previously mentioned, the National Health Insurance Survey states the percentage of uninsured Americans went from, quote, 16% in 2010 to 7.7% in 2023, end quote. But ultimately, this is about the moral component of letting innocent individuals lose their lives too soon simply due to a lack of insurance, high deductibles, or copays, / other barriers to healthcare in our country. Having a mixed healthcare system in the United States has caused a moral dilemma in naming the financial price point on the lives of those without health insurance. Some may argue that since the percentage rate of uninsured Americans was decreased to 7.7% according to the 2023 article, this means that we have been successful and the work is completed. However, there are still patients that are rationing medical supplies or even completely ignoring their symptoms on their own simply due to barriers they experience. Even if you believe that the benefits of a mixed healthcare system to the general population would outweigh the struggles of the uninsured, there is a different level of morality when discussing unnecessary death. In such a modern world, and in a high-income country, there should be little or very few occurrences of these situations of medically preventable death. Additionally, there are other components to the discussion, such as how if the American Air Act was successful, then why not proceed with pursuing ultimate health freedom for all Americans by allowing universal health coverage? In the past, the United States has always evolved, changed, and grown in every way possible, including our healthcare system. As time continues to move on and more patients are experiencing acute illness, disability, or even fatalities due to not having access to healthcare, it shows the priorities of our country. Prioritizing the comfort of a select few versus prioritizing the safety of all is the moral dilemma which is at debate.